Hi everyone, welcome back to my YouTube channel Word Wizard. I'm so glad you are here again. If you have been following along with our OET preparation series, you will know we have already gone through 6 different sample OET letters for nurses, and each one has helped us build a new skill and see how these letters work in real exam situations. From those letters, we focused on the basics, how to introduce the patient, set the right tone, and make sure every key details is clear. Now, here we are on our next letter, that is the Gerald Baker letter. This case is especially valuable because it's a kind of scenario you might actually face in OET exam. In this video, we are going to go step by step from analyzing the case notes to structuring the paragraph to writing a strong closing. So you will know exactly how to handle it if something similar comes up to your test. So whether you have watched all our previous videos or you are just joining us for the first time, this is going to give you another clear practical example to guide your own practice. By the end of this session, you will have one more strong tool in your OET toolkit and one more step towards the score you are aiming for. Come on, let's jump into the content. Mr. Gerald Baker is a 79-year-old patient on the ward of a hospital in which you are the charge nurse. Next, we move on to the patient details. Mr. Baker is a widower of 8 years. He was admitted on 3 September 2010 to City Hospital and will be discharged on 7 September 2010. His diagnosis is left total hip replacement, that is THR, and ongoing high blood pressure. Next, we move on to social background. He has lived at Grey Walls Nursing Home for the past 4 years. He has no children and was employed as a radio engineer until his retirement at the age of 65. He is now an aged pensioner. His hobbies include chess and being a ham radio operator. His sister, Dawn Mason, aged 66, visits regularly and is very supportive. He plays chess with Mr. Baker on her visits. There are no signs of dementia observed. Next, we are moving to medical background. In 2008, he had osteoarthritis requiring total hip replacement surgery. In 1989, he was diagnosed with hypertension, which is under ongoing management. In 1985, he sustained a Colles fracture and was treated with ORIF. Next is medications. Aspirin 100 mg morning has been recommended. Post-operatively, he takes Ramipril 5 mg morning and Panadin Forte, that is Cocodamol 2 tablets twice daily as required. Next is nursing management and progress. Daily dressings have been applied to the surgery incision site. He has been undertaking range of motion, stretching and strengthening exercises and occupational therapy. His staples are to be removed in 2 weeks on 21 September. Follow-up FBE and UEC tests will be conducted at City Hospital Clinic. Next is assessment. He has good mobility post-operatively. He is weight-bearing with the use of a wheelie walker and can walk the length of the ward without difficulty. He experienced post-operative disorientation in time and place during recovery, possibly related to anesthetic, and continued observation is recommended. Mr. Baker's hemoglobin dropped post-operatively to 72, requiring transfusion of 3 units of packed red blood cells. His hemoglobin is stable at 112 on discharge, but ongoing monitoring is required for anemia. Then next one is discharge plan. Please monitor his medications, particularly Panadin-4, preserve skin integrity and continue his exercise program. Equipment required includes a wheelie walker, wedge pillow and toilet racer. The hospital will provide the walker and pillow. The hospital social worker has organized a 2-week hire of the toilet racer from a local medical supplier. Next, we are moving to writing task. Here, using the information in the case notes, write a letter to Miss Samantha Bruin, senior nurse at Greyvolds Nursing Home, 27 Station Road, Greyvolds, who will be responsible for Mr. Baker's continued care at the nursing home. Now, I am going to guide you through the writing task based on Gerald Baker. If you are preparing for exams or improving your writing skills, this video will be super helpful for you. Here, the task focuses on writing a formal letter and Gerald Baker is the main character or client we are writing for. The goal is to show your ability to write clearly, professionally and in a structured format. The key points to cover. Here, what we will go through step by step. First one, understanding the case notes about Gerald Baker. 2. Organizing those notes into a logical order. 3. Writing a clear introduction and using the right tone. 4. Making your writing concise and formal. 5. Checking for grammar, spelling and flow. Now, I will show you how to turn simple notes into a professional letter. We will focus on who we are addressing, why we are writing the letter, the key medical or personal details to include, and also how to wrap it up perfectly. And also remember, always use formal language and keep sentences short and clear. Examiners look for structure, accuracy and tone. So practice is the key. Let's get started with Gerald Baker's writing task now. Date and address. 7 September 2010. Miss Samantha Bruin, senior nurse, Greyvolds Nursing Home, 27 Station Road, Greyvolds. Dear Miss Bruin, regarding Mr. Gerald Baker, aged 79. Introduction paragraph. I am writing to update you about the current health status of Mr. Gerald Baker, who requires continuing care and management following his discharge today. He is recovering from total hip replacement surgery. Next, Mr. Baker was admitted to hospital on 3rd September 2010 and underwent the surgery successfully. Post-operatively, he had disorientation to time and place, possibly due to anesthetic effect. Therefore, he requires continued observation. In addition, his hemoglobin level dropped to 7.2 and transfused 3 units of packed red blood cells. Today, his hemoglobin level is within normal limits, but requires ongoing monitoring of anemia. Next paragraph. During hospitalization, Mr. Baker was commenced on aspirin 100 mg in the morning and Panadin-4 4 times a day as needed. He has been initiated range of motion, stretching and strengthening exercises along with occupational therapy which needs to be continued. Currently, he has good mobility with the help of a wheelie walker. Next paragraph. It would be appreciated if you could monitor Mr. Baker's medications, especially Panadin-4. Kindly preserve skin integrity and continuous exercise program. Please note, he needs a walker and wedge pillow which was provided from the hospital and toilet racer is hired with the help of hospital social worker for 2 weeks. Of note, his staples to be removed on 21 September 2010 when he has a follow-up for FBE and UEC test. Conclusion. Please do not hesitate to contact me if you have any queries. Yours faithfully, Registered Nurse. And that's the complete case note review and writing task for Gerald Baker. I hope this step-by-step explanation helped you understand how to structure your ideas clearly and write a professional letter with confidence. If you found this video helpful, please give it a like, share it with your friend and subscribe to the channel for more writing practice and tips. Drop your questions, suggestions or topics you had like me to cover in the comments. I had loved to hear it from you. Thank you so much for watching and I will see you in the next video. Once again, thank you for watching.